Hello, and welcome to the Unquiet Mind podcast. I am your host, Dawn Morgan. Really happy to be here. Very, very excited. Today, I am with a dear friend of mine, Courtney Lang. I am joined by this beautiful, wonderful individual. And hello, Courtney.
Hi, Dawn. Thanks for having me.
Thank you for being here. I will just share just a small bit about Courtney and then let her speak about herself. Courtney Lang is a strategic communications and health policy expert whose primary focus is advocacy, activism, and grassroots mobilization. She is a principal and founder of Langco and Partners, and stop me if I say anything incorrect, a public affairs firm recognized for mobilizing constituencies to achieve impactful business goals aligned with equity and healthcare and public policy. Courtney consults with organizations on access, affordability, structural racism, and the importance of systemic change. So, Courtney, again, thank you for being here. Would you like to share just a bit about yourself before we dive into this amazing topic?
Certainly, I'm delighted. So thank you so much for having me as a guest. And I think you did an amazing job at the introduction. Thank you so much. I will just add that the focal point of my work is truly health equity and the intersection between equity and social impact and social change. So what does that mean? It really is what I consider the pivot point for healthcare. And as a lifelong patient advocate, this is an opportunity to reconcile some of the inequities in healthcare with the health justice needs to serve patients and communities.
That's amazing. Before we dive into our topic, I wanted to ask, what was your motivation to become this, I don't know if I would say patient advocate, but to frame your work around patients and equity and just kind of align yourself and your work with what you do? What was your motivation?
Sure. I often speak about how we are all patient advocates, whether we self-identify that or not, because we're born into the world as a patient and we will most likely exit the world as a patient. I always try to remind audiences of that. So as a child, I did experience some health challenges, and it really sensitized me to the needs of others within the broader context of the health system. And my career had begun really in the advocacy and alliance development domain on the private sector pharma side. And then when I launched my own company, it really focused on the public health needs and more around what happens at the community level and how can we really impact change there. So my lens has shifted a little bit, but it has always remained ever vigilant to how people are socialized within our broader healthcare system and how we are empowered as individuals. And so if nothing else, that's really my motivation to continue this, what I consider more of a crusade for justice.
I love that. I love that you said you have to really think about, you're born into this world as a patient, and it creates a different perspective for me, at least. For many years, as everyone knows, and because I've spoken about it ad nauseum, that I have multiple sclerosis, and I think living life up until age 25, which is when I was diagnosed, I never thought about, oh, I'm a patient, or something could possibly go wrong one day. I just thought, oh, I'll get sick when I'm like 74, you know what I mean? Or 82. You just don't think about all of the intricate details that come into healthcare and how we govern ourselves and how we are governed by this healthcare system.
Yes.
If that makes sense.
Yes.
But today I want to kind of give you the floor, and I will be asking a lot of questions because as a patient of having MS for 21 years, I never thought about, and this is the honest truth, I never thought about health disparities. And that's so interesting because I'm a Black woman. How can I not think of that?
Right.
But I think because I've been so lucky, blessed, fortunate to have two parents who are in the healthcare field and have been my entire life, I have been, I guess, privileged in a way.
Yeah.
And so I haven't had to think about it until recently. And now all of this talk about health equity and health and equality, you know, what is the difference? Why are these buzzwords ringing around our heads? Why is it important to me? Why is it important to you? Why is it important to, you know, others? You know, my white friends. Why is it important? Why do people need to know that this is something that we should talk about? And so I would love to get your perspective and your expertise and your knowledge on what is the difference between health equity and, well, let me back up, equality, equity, and disparities. How do we differentiate? What is this all about?
Certainly, certainly. Well, you said some important observations before you actually asked the question. And I wanted to kind of piggyback off of how did we get here?
Yeah.
And then I'll give the definition. So why are we at this phase? You know, that is a question that I get daily. And I do think that it's important to understand the landscape that we find ourselves in today. So when George Floyd was murdered last year, and the country had to come to terms with itself related to race, identity, ethnicity, and the impact and plight of our systems for people of color, it also gravely impacted healthcare because the pandemic was raging Black and Brown communities at a disproportionate rate. And the death toll continued to rise in underserved or under-resourced communities that were disproportionately reflecting communities of color or minoritized communities. And so the confluence of the events of the pandemic, as well as George Floyd's murder, also impacted the way that our system of healthcare started looking at itself. So for many of us who have been on this long journey to educate and advance and accelerate knowledge about health equity, this is not a new conversation. This is a conversation that we've been having for decades. Now it has become, I think, more acceptable and more expected to have a dialogue about health equity. I'll just pause there just to kind of take that in.
Yeah, it's incredible.
Yeah. So in terms of the definitions of what do all these different but very overlapping terminologies mean? So health equity, and from a very basic level, is the opportunity for everyone to share in fair and just healthcare. Now, disparities are differences. Health disparities just means health differences, and differences can exist for a variety of different reasons. There are differences based upon our geography, rural versus urban communities. There are differences based on population. Certain populations will experience disease burden or disease prevalence at a greater rate than others. And so, you know, in your experience as an MS patient, you have probably seen, you know, statistics in terms of people of color maybe not getting diagnosed early enough into disease progression or misdiagnosed at a greater frequency than majority populations. So disparities in and of itself are really just the differences. And when we're having a conversation about health equity and health disparities, we have to reconcile the differences between considerations around the opportunity for fair and just healthcare. So to put it real simply, everyone is not equal ergo the disparities.
Mhm.
So when we have health systems that are constructed where equality is not the goal, and we are having to adjust based on creating equitable health outcomes, we have to actually take a look at the fact that, yeah, while equality may not be the goal, it's also not the solution, because we're all starting at a different vantage point.
Exactly.
Our communities are suffering at a disproportionate rate. That is true. That's why I think the pandemic reality is something that we need to continue to illuminate.
Mhm.
We're becoming more comfortable with disease burden in Black and Brown communities. That is problematic.
Sure.
So the movement for health equity is to hold individuals, providers, healthcare systems, places of care accountable to making sure that health is something that we as individuals all deserve.
I saw an example, and you can, dive in and explain with equity and equality. It's, I was reading something online and they said
Mhm.
that if a clinic offers free healthcare or free screenings for X, Y, or Z,
Mhm.
illness,
Mhm.
and they offer it at 8 o'clock in the morning only,
Mhm. Mhm. Mhm.
that is offering to the community saying, yes, it's free. Everyone, it's equal. Everyone's equal.
Yeah,
However, there's some people who can't take off of work.
that's
They
right.
work a first shift. They are coming off of a late shift. How can they
Absolutely.
get there? They have
Absolutely.
kids that they need to get to school. So
Mhm.
is there equity there? I don't know. You know what I mean? And so this is what I would want you to, talk about, because I found that was an interesting example. Because although they're offering free health screenings at 8 o'clock on Tuesday,
Mhm.
it's fantastic, wonderful.
Mhm.
It's free. I can go and it's offered,
Mhm. Mhm.
but I can't get there because I'm working. And if I take off, then I will lose $100, and I need that $100 to pay my utility bill, or shoes for my son or daughter. And you understand that example? Do you want to
Absolutely.
talk more about that? Can you talk more about that?
No, absolutely. And this really is a conversation on why addressing the social determinants of health are so critical to making sure that we are achieving the aspirational goal of equity in healthcare.
Mhm.
And I say aspirational because in order for us to really achieve that goal, we actually have to come to terms with there is injustice and there is not fairness in the system. So the example that you highlighted is perfect, really, and a real world reality. I mean, we saw this when it was the initial vaccine rollout, restricted hours, certain communities, not everyone having the ability, to your point, to take off work. So these are social determinants of health realities: transportation,
Yes.
housing, deficits around food security or insecurity or lack thereof, education, and the economic factors that differentiate populations of people between poverty, lower income, and those with means and privilege.
And I think when you come from a place of privilege,
Mm-hmm.
it's difficult to see
Mm-hmm.
that there are disparities, because you're
Yeah.
saying, hey, you're offering
Yeah.
a free service, so why not take it?
Mm-hmm.
But they don't see the underlying issues. This is a layered problem for people who have other jobs, other responsibilities, comorbidities, because what if they have to see a specialist
That's
at
right.
that time
That's right.
every week,
That's right.
and they can't make it for this health screening for that particular illness?
That's
You understand?
absolutely, absolutely. And acknowledging that there are differences that individuals experience is critical to making sure that the system's actually working effectively or is designed to. And so you bring up another, I think, salient aspect of this conversation, which is access, right? I mean, at the end of the day, this is an access conversation. We can have the most innovative, progressive, advanced healthcare system in the world, but unless people are able to access the system across the board, it's ineffective, right? At best, because we basically are designing innovation for a subset of the population and not the masses. And so this kind of puts public health at tension with private sector privilege. And it's something that should be acknowledged. You know, it was interesting. Recently, I had a hospital CEO tell me about a year ago during the height of the pandemic that she did not do public health. And I was stunned. I was like, oh, okay. Don't we all do public health? I mean, isn't that what we're all advocating for? I mean, and if the C-suite doesn't see itself as a steward of public health or a steward of public good, then we are unable to address those determinants of health or those influencers, of healthcare. There are 32.8 and growing million Americans that are experiencing poverty right now. We have escalated these numbers during the course of the last 18 months over COVID. It's only going to continue to increase. So if we don't create solutions to care, and that's really where I feel like the health equity conversation should be focused. Health equity should be viewed as a solution to care because everyone is deserving.
That was my question, my next question. I didn't want to really jump around.
No.
But how do we find solutions? How do we find a resolution to this issue, to this problem? Do we go the policy route? Do we write our senators? Do we go, talk to Congress? What is the answer? I know that that's a big ask. And it's a hard question to answer, really. But where do you even start? Maybe we can just talk about that. Where do you start?
Sure. Well, I definitely think that we need to start with self, right? So and starting with self is really taking responsibility. How are we contributing to the problem, or how are we contributing to a solution to the problem? And part of that is accountability. So we must hold our providers of care across the board accountable to equitable practices. That's what we can do. We can also make sure that in our locality, our cities, our counties, etc., that services are distributed with some sense of equitable distribution of resources. We have to hold spaces and places accountable. And so with a growing safety net in terms of need and a shrinking safety net potentially because of resource deficits, this conversation is really important. So you mentioned policy solutions. So those are our upstream kind of solutions. And we do need to actually participate in the process to make sure that we're holding elected officials accountable at all levels of government. But to the extent that we're disengaged, it actually doesn't help our health, right? So we must understand that we as individuals have a responsibility to be good advocates for ourselves, for our family, for our community. And in doing so, we can only help to advance the healthcare paradigm or the justice in healthcare needs for each other.
I love that you said that. You said a word that was just kind of ringing in my head, community. Because just because I have multiple sclerosis doesn't mean that I won't speak with someone who has lupus.
Right.
And come together with someone who has rheumatoid arthritis.
Yep.
There are issues that affect us where there's strength in numbers, if you will.
Always.
We can always come together and say, hey, your medication is $30,000 each time you see your
Mhm.
physician.
Mhm.
My medication is 50. Her
Mhm.
medication or his medication is 150.
Mhm.
What can we do? How can we hold these healthcare providers or big pharma
Mhm.
accountable
Mhm.
for those who cannot afford it, or for those who can, but it's a struggle? And
Yeah.
I love that when you said community, because it isn't just you. Yes, I agree. You do start with self
Mhm.
for sure. But
Mhm.
then I think once you start with self, you go in and you join with others. You
Mhm.
talk about this, because quite often when you have an illness,
Mhm.
you become so individual. I don't know the word. It's individualized. You're not thinking about anyone else but yourself
Okay.
and your
Yeah.
illness. Yeah, your illness.
Yeah.
And you kind of forget to ask questions. You just listen to
Mm.
the doctor, and so you're not holding the healthcare professionals accountable.
Mhm.
You're just sitting there and you're accepting what they're saying, and you're taking your paper and your brochures and you're walking out the door, and you're just not really diving into what's happening around you or what's happening in this world. And there are
Mhm.
other people who cannot afford medication
Right.
or cannot afford to see the top specialists in that
Mhm.
area.
Mhm.
And I think that that's a big issue. Again, it's layered, but
It's layered.
I
Yeah.
do agree, starting with yourself and making sure that you're holding your healthcare providers accountable is key. That's the
Absolutely.
start for sure.
Absolutely. And I love the way that you said that joining in community with others in the chronic disease space is something that you have done personally. And suffice to say that we all need to join into community with others. And addressing chronic disease holistically is crucial, right? It is the conversation that needs to happen more broadly, because we can't separate ourselves from the whole. So, just to touch on maybe briefly some of the access challenges, I know we talked about like equity, but there's also like equity in pay and income, and access to quality services, as you articulated. And so what does that mean for individuals kind of going forward with drug pricing escalating, et cetera? So I mean, there are two thoughts to that, and I want to acknowledge that there's no easy solution. So I understand that there is an information deficit. Just as you mentioned, that not everyone is going to have access to the top specialists and providers. Not everyone's not even going to know how to even begin that process or that journey. But this is really where I believe that the advocacy community as a whole is so important.
Mhm.
Even if you don't know where to go, I think identifying with other advocates helps to at least create a process and a community, and helps to build trust in a movement around mitigating disease burden.
Right. Because just because it didn't happen to you doesn't mean
Mhm.
that it's not happening.
Correct. Absolutely. 100%.
Mhm.
100%. Yeah. And it happens, right? Like all the time.
All the time.
Yeah.
I've had people tell me in previous podcast episodes,
Mhm.
it took me years to get diagnosed. And
Mhm.
I was flabbergasted.
Mhm.
And I would say, how is this possible? How does that happen?
Right.
And I almost had this, I don't know what the word is, hubris. You know what I mean? I was
Yeah.
quite like, "Ugh, that doesn't happen." And
Mm.
I felt embarrassed
Mhm.
hearing story after story.
Yeah.
Yes, this is happening. And not until I became a patient advocate and really dove into this community and diving into other communities and listening to
Mhm.
other people's stories that I
Mhm.
realized, yeah, there's some major structural racism going on here. There's some major
Mhm.
issues. It's
Mhm.
systemic. It's
Yeah.
and not only is it that, I would say there's a class issue. For
Yes.
sure.
Yeah,
Whether you're Black, white, Asian, purple, green,
absolutely.
you have money, you have the best care. In,
You have
in
better
many
care.
cases, better care.
You have better care.
Better care. In
Yeah,
many
yeah.
cases,
In
not
many
all
cases.
cases.
Right. But the opportunity
The
is there.
opportunity.
Yeah.
You can go to your bank and say, you know what, I need to take out some money because I've got to get this treatment. You know what I mean? You can go to
Right.
Mexico and get whatever treatment it is. A lot of people don't have that option.
Mm-hmm.
You know,
Mm-hmm.
just really quickly, there's a particular medication, a disease modifying therapy
Mm-hmm.
that they're using now for MS patients.
Hmm.
And you can only go to different parts of the country to get it done because it's super, super expensive. And a lot of people know about this,
Mm-hmm.
this treatment.
Mm-hmm.
But the treatment in Mexico, out of the country, is top notch. But who can afford that? You know what I mean? A lot of people can't afford that type of care. And it's unfortunate that you see people suffer, you know,
Yeah, unnecessarily. So that goes back to, I think the greatest inequity in healthcare is information.
Mm.
All information is not disseminated equally. Okay, so
Mhm.
you know that information,
Mhm.
right? Because you've been privy to a more elite network of researchers, of clinical understanding.
Yeah.
It's a part of your norm, right? But going back to the original example that you used, I have to be at work at 8. I don't get off maybe to 7 or 8 at night. I have kids at home. I have a family. I'm not necessarily going to have the time or the social capital to be able to navigate systems of care. And this is where the heart of the advocacy movement must reside. So you talked about sort of structural racism and kind of how does that play into the broader narrative? Well, institutions and organizations may or may not acknowledge that structures are set up to either inhibit care, right? Or to amplify care, right? So if you're not a part of the way the system was designed, you cannot achieve optimal healthcare goals.
What a good point.
And so race and ethnicity are 100%, 100% variables in the type of care that is offered to you within this ecosystem that we find ourselves in called healthcare. Whether it's traveling to Mexico or even just having the knowledge about, you know what I mean? Like you have the knowledge, correct. I mean, the opportunity I feel like is one step, but the knowledge gap is before you would even
get to that point.
Yes. Correct. Yeah, absolutely.
Oh, for sure. Wow. We are going to this is going to be a series, health equity, equality, disparities. We are going to dive into a little bit further into how social determinants of health impact equity.
Yeah.
We're going to lead into that on the next episode. If you wanted to touch on it right now, that's fine.
Yeah.
But maybe leave people with just a little good flavor in their mouth or something.
Yeah, I mean, I think that we all need to realize that the opportunity to have a conversation about equity in healthcare begins at the beginning, long before we actually need medical care. And so to be a participant for self, for family, and for others is really being a justice warrior for healthcare. And that is the level of power and encouragement that I always like to leave people with. I never want anyone to feel defeated by the system. Rather, I want each of us to feel empowered that health and wellness is your birthright. And we are here to make sure that you have the absolute best opportunity to achieve what you are rightfully owed within the system.
I love that. Absolutely love it. Makes me want to do some reading on Cuba's healthcare system.
Yeah.
You know,
Yeah.
what's the difference between
Right.
theirs and ours, and
Mm.
why are so many things successful in their healthcare world
Mhm.
versus ours? You know, what's lacking here?
What's lacking?
And I think what's lacking is everything that you just described so eloquently. So
Thank you.
I wanted to thank you. I hope I touched on
Yeah.
everything. If we missed a few points, we can always lead into it on the next episode or the following one.
Mhm.
But I want to thank you so much for being a part
Yeah.
of the Unquiet Mind podcast, or coming on this episode, the first of many. And I'm just really, really excited. I'm honored that you're here and sharing your expertise and your knowledge, like I said in the beginning. And this is such a great, great topic. And I'm just really happy to dive in. Very, very happy.
Thank you so much. I just stand in gratitude to you for giving voice to so many that need you to continue to put out such great information. So the pleasure is mine.
And before we go, do you want to share? Are you writing a book, or are you out there on social media, or do you have a YouTube channel? Is there anything you want to share about who you are, or you're just working in your field and you are happy to be there right in this moment? Is there anything? I always ask guests, is there something that you want to share about yourself? And if it's not, that's fine too. But we'll continue talking.
We aspire for all of this
Okay.
when there's some extra hours in the day, but I am 100% available to help communities, individuals, and organizations to continue the dialogue and to really advance solutions to care at advocacy@langcopartners.com.
Fantastic. Thank you so much, Courtney.
Thank you, Dawn.